Arizona health leaders have a warning tonight. Hospitals could soon have a ration care for coronavirus patients as the number of cases continues to surge. News 4 Tucson's Eric Fink reports on what this could mean for our community if someone needs medical care at a hospital.
Just today, Banner Health halted all elective surgeries across its healthcare system because some of its hospitals are over 100% capacity statewide. And health officials worry that soon hospitals could be making very tough decisions, deciding who potentially gets life-saving treatment and who doesn't. It's a scenario no healthcare professional wants to think about.
Kind of picking who's winning, who's losing, who's living, who's dying.
Hospital physician Matt Hines says some Arizona hospitals are getting close to having to ration care as the demand could soon exceed available staff and resources.
That's not a place where we should be or where anyone wants us to be. And it looks like we're getting there we're getting pretty close.
As we start 2021, Banner Health stopped all elective surgeries to free up space for COVID patients. TMC did so almost 2 weeks ago.
Can I say with all certainty that we will not be in a situation where we totally overwhelm the system? No, I don't feel comfortable saying that at all.
What would it look like if our hospitals become overwhelmed?
If you think of healthcare as a funnel, what you would see is backup of the funnel. So people would still get care, but there would be longer times for them to get it.
Pima County Health Director Dr. Teresa Cullen says in this situation, patients would have to stay in ambulances longer before getting treated inside the hospital.
Not the pickup time, but to get them out of the ambulance into the emergency room, because remember, there has to be a bed.
Hines says he hopes we don't get to a point where resources become so thin that frontline workers are forced to make these difficult choices.
Who gets the particular type of oxygen therapy, or who gets this particular drug or intervention that there's just not enough of to go around.
Under triage protocols, people more likely to live longer are first in line. For example, 20 to 50-year-olds getting priority care ahead of elderly patients.
I mean, it's just gross. I mean, it's just not the way that I'm certainly used to practicing medicine, having to think about that.
And on this first night of the new year, according to the Arizona Department of Health Services, 4,500 Arizonans are in the hospital with COVID-19, 1,800 more than a month ago. We've got you covered from the north side. I'm Eric Fink, News 4 Tucson.